Are you worried that you might have a torn rotator cuff muscle in your shoulder? If so, stick around and I'm going to show you how to tell if it's torn or not. Hi, my name's Justin, Doctor of Physical Therapy and founder of The Active Adult. You're joining me here today in sunny Sarasota, Florida at one of our 7 physical therapy clinics. Shoulder pain or problems with the rotator cuff or rotator cup, as so many of our patients so commonly refer to it as, is very common in adults over the age of 50. And with our patients, most of them report that this happened kind of insidiously or wasn't tied to a traumatic event. They just woke up one day, maybe after using their arm, maybe digging holes, planting some trees, lifting something, and the next day they started to hurt, and that problem kind of snowballed worse and worse as the days and the weeks went on. So they come to our clinic. Sometimes they had seen their general practitioner or an orthopedic surgeon even. Maybe they've got an x-ray, but they haven't done anything that definitively can tell if they have a tear in their rotator cuff or if it's just a strain, inflammation, or some other problem with their shoulder. Here are a few of the tests and questions that we have our patients complete so that we can have a better prediction of whether or not they actually have a tear. First, we want to dial in the exact location of the pain. By far, the most common tendon to be torn in the rotator cuff is called the supraspinatus. The supraspinatus attaches to the greater tuberosity on the lateral aspect of the humerus, shown here, which is just the upper part of the arm, and more specifically the ball of the upper part of the arm. When the supraspinatus is involved, or kind of the shoulder joint in general, you can get a radiating pain down the side of your arm. Patients all the time, they come in and say, no, it's not my shoulder, it's my arm down here. Don't fall for that trap. It's actually the shoulder that's involved, and that's just a referred pain, as we call it. A great test to determine whether or not the supraspinatus muscle is involved is called the champagne toast test. The champagne toast test has been found to be about 5 times more effective than the commonly used empty can test, which I'm not going to show you the empty can test because it's been shown to be 5 times less effective than the champagne toast test. The champagne toast test is going to be kind of the position that you would naturally toast a glass of champagne. You're going to be abducted or out to the side, slightly externally rotated, and slightly flexed with your shoulder. Elbow bent about 90 degrees. Then you're going to apply a nice downward force onto your elbow. And if that hurts, right where I was telling you about earlier, then the supraspinatus may be involved. Another movement that can further help conclude whether or not you have a tear is just your ability to raise your arm up over 90 degrees. And what our patients with tears do is they start to raise their arms and they get to about 70 degrees and you see that shoulder start to pop up in the air and they struggle to get past 90. They stop about here and they're not able to fully lift their arm overhead. Whereas when you have healthy motion, you're able to keep that shoulder depressed and raise that arm all the way up, point towards the ceiling. If you start to do this, you may or may not have pain, but a lot of times you're going to reproduce that same pain that we've been talking about in the lateral aspect of your shoulder. Lastly, if you're not sleeping well because your shoulder pain is waking you up multiple times per night, then there's a decent chance that you have a more serious injury like a tear going on in your shoulder. There is one giant caveat to everything that I just told you, and that is that any one of these tests or measures or answers to the things that I just talked about by themselves doesn't strongly support that there's a tear. But multiple, the more that you have positive, the better chance that there actually is a tear. So if you fail the champagne toast test and you can't lift your arm past 90 degrees and your shoulder pain's waking you up multiple times per night, then there's a pretty good indication that you may have a tear. Just because you may have a tear in your rotator cuff doesn't mean you need to rush and have surgery. In fact, we see hundreds of patients in our clinic every year that have a confirmed tear of the rotator cuff sent to us by an orthopedic surgeon who thought that their best approach was to do physical therapy. If you missed our last video on things to do when you have shoulder pain, check it out by clicking the link below. But a good physical therapist should be able to tell after working with you for 2 or 3 weeks whether or not you're going to be one of those candidates that can do great without surgery. If you found this video helpful, please like it and subscribe to our channel by clicking the button below. That way, you'll be notified every time we release new content. Our sole purpose is to get you moving, keep you moving, so that you can live the life you love. Until next time.